Hey, good evening, everyone. Thank you so much for joining me. Yay. Hi. So there is so much to cover today, and I want to make sure that I get through everything. Bear with me here. I think there's some comments, so go ahead and let me know where you're coming from. I want to thank. I could see here. Felicia's saying good evening. I have Angie saying good evening to everyone. I love this platform. I could put what you say out there. So if there are any questions as I go through my presentation, just let me know in this area and I'll definitely be putting it up. So I am running solo here. So let me go ahead and get started. Thank you so much for joining, Connie. Please remember to share with all your family and friends on there. I have a lot of awesome information to cover with you. So I want you to stay tuned. Got to get this going. All right. So let me get over here and get ready for the presentation. I hope everyone is doing well today. This is my first time doing Facebook Live. I'm so used to my webinar things, right? But we're going to get this today. Indeed, we shall. Okay, that's better. There we are. So, again, thank you all for joining. So, if you can hear and you could see, we have Peggy. Thank you for joining, Peggy. So everyone is able to see and hear me. So what I'm going to do now is just get started. I'm seeing some names of folks that I don't know. Good evening. Thanks for joining. My name is Queen, aka Dr. Williams. Lots of stuff I've been blessed to do in the past, lots of schooling. I'm a radiation oncologist by trade. A lot of things are listed here on the screen, as you could see. So today, this is a community session, a community event, if you will, a global event, because I know I have folks joining from England and Jamaica and other places. And this is brought to you by Q4CD. And that's Questions for Cancer Doctor. This is about your breast health. And this really is the basics that everyone should know, everyone, including you. So I'll be covering some information just on, what you should know about your breast. And some of you have sent me some questions, and I want to make sure that I answer all those questions as well. Your breast, the basics that everyone should know. Y'all ready for this? Y'all ready? All right, here we go. Let's get started here. So, why do we do these free health education events or these few education webinar, right? I'm a doctor. I could be doing other things. I see patients. Why is it that I think it's important for us to do this health education event? Well, first things first, everyone is so busy. You're running here, you're dealing with the kids, you're dealing with your family, you're dealing with your husband. You are busy, you're on the go all the time. And I always like to use motor vehicles or cars for comparison, right? So everyone is a different type of car. And you are rushing here and there. You're doing everything and you're not taking care of yourself. So, doing this health education stuff is because I want you to take the time to pause. And while you may not look under the hood, you got to make sure that you're getting the gas that you need to get, right? You got to make sure that everything is getting tuned up. A car is very complex, but let me tell you something, sister friend. Your body is even more complicated than a vehicle is. And just as how you take your car in for checkup, you stop and get oil all the times, you have to do the same thing for your body. So that's the reason why we are doing this. One of the more important things, though, is as females, we do not take care of ourselves. We're so busy taking care of everybody else. And so I'm hoping that this will be a pause where you could take the time to take care of yourself. Hi, Cora. Thanks for joining. Hi, Patrice. And hi, Peggy. I like to acknowledge folks as they join. Thank you so much. Hi, Sandra. Thank you for joining. So today we're going to be focusing under the hood a little bit. Well, the breast isn't really under the hood, right? It's on the body. But we're going to focus on your breast health and some of the things that you need to know. These are just an overview of the things I'll be covering, the statistic and understanding and knowing about your breast. When was the last time you had to sit down and review talking about something specifically about your health, right? So that's what this is here to we're going to do today. So, we're going to start with statistics and why this is so important, right? So, 1 in 4 adults will be diagnosed with cancer, just cancer in general, in their lifetime. 1 in 4, right? Regardless of how you like to see numbers. See, I came ready for you. 1 in 4 will be diagnosed with cancer in their lifetimes. So it's important to know about that too. So here we go now. This is an estimate of new cancer cases. And this information I did receive from the American Cancer Society. And this was from, I think it was 2020, but it gets updated every few years. So if you look at these numbers, it is showing you what's the most commonly diagnosed cancer in males and females. You see, for males, it's prostate, lung, and colon rectum or colorectal cancer. For females, it's breast, lung, and colon cancer. But the leading cause of the leading diagnosis of cancer in females are breast cancer. And you see here it gives a number of over 207,000 people being diagnosed with breast cancer every year. So you need to know some of the basics about that. Again, for adults, the cause of death, the number one thing is cardiac, which, and then number two, we have cancer. Approximately 50% of all males and 33% of all women develop some type of cancer. For breast cancer, it's 1 in 8. So if you know 8 females or 8 ladies or 8 anyone, one of them will be diagnosed with breast cancer in their lifetime. Okay. So all of this information is just talking about the risk of developing most cancers and how and what you can do to decrease your risk. Right now, I'm going through this because the sooner you're able to diagnose and find a cancer and treat it, the better your chance are for living many years with the cancer. Hi, Leonore. Thank you for joining. Right. So you want to be able to keep looking after yourself, getting your screening. So if something should occur, you'll catch it sooner rather than later. Right. Okay, so now we're going to get into the nitty-gritty of it. That's all for statistics, I promise. That was it. Now we're going to get into the nitty-gritty of things here. Um, we're going to now go into the basic of breast anatomy and talk about breast cancer screening. And I have some of the questions you've sent for me before, and I'll answer that. So here we go. Get to know your breast. I bet you haven't had anybody tell you that before, right? Get to know your breast. Why is that so important? We are going to go into that. So, looking at this picture here, this is a side view, what we call anatomy, a picture of your breast. And it is showing you that you could see the muscle along this area. The brown represent the muscle. In this area here is the fatty area that makes up the breast. The blue that you're looking at here is like the lungs. The breast sits on top of your muscle, which sits on top of the rib here. And there are a lot of changes that can go on in the breast, and it does not matter the size of your breast either. Some of the questions I've received had to do with, well, my breast is too small, or I have an implant. Does that really matter in me getting to know my breast? Look, I'm telling you, it doesn't matter if you have an implant. It doesn't matter if your breast is small or large. You are still at risk for breast cancer, and you still need to get to know your breast. Now, there are different ways that you can have a breast implant, right? And it can be here where it is behind the muscle. Remember, we say the lung is here. These little things right here is the rib. And this is a side view. So imagine you're turned sideways and they're cutting through the breast, right? And you could see the nipple here. So in some cases, they can put the implant behind the muscle. In other cases, they put the implant in front of the muscle. Because you have the implant, there can be some changes, be it from the surgery or whatever it may be. Do not be your own mechanic. You need to get to the doctor should you feel any changes in your breast. That's what I mean by getting to know your breast. So let me go through another step and tell you just how and what you need to do in order to get to know your breast. Here we go. We talk about breast exam, and we'll get to that a little bit more too. But I'm using this picture here simply to show you that your breast is not just what's in front of you. It actually extends all the way up to under your armpit. So when you're doing your breast exam, you have to do everything that's in front as well as up under your armpit. And you'll see in other places, sometimes, we have a lot of internet doctors and they're like, well, it says to examine my axilla. What is that? I know, right? It's like us medical folks, we come up with terms, but axilla, the armpit, is the same thing. And you want to feel up under your armpit because that's where you have lymph nodes. And if you look at the breast, the tail goes all the way up under there. And I've had many patients in the past who has had cancer right in the tail of the breast. Sometimes, too, if lymph nodes are involved, it would be in this area. And we'll talk about the difference in knowing, well, how do I know if it's an ingrown hair versus a lymph node that's involved? Again, that's just showing where the lymph nodes are. Now, you need to do your monthly breast exam and your annual mammogram as well. I cannot begin to tell you the amount of patients I've had in these 16 years who said that they had a mammogram and then 3 months later they felt something and unfortunately it was diagnosed as cancer. So my seeing you or you're having a mammogram once a year is not enough. You have to know your breast so that if there's a change, you can pick it up. I've also have, I would say about 5% of my patient population where their significant other found the lump in their breast. So if you don't know your breast, your significant other may know your breast well enough to feel that there's a change. Hey, this is an adult conversation. So you know where I'm going with that, right? So but when you're doing your breast exam on the Queen Quanta website, there's a link to take you to a video that shows you specifically how to do the breast exam. And it's just showing you here how to do your self examination, standing in front of the mirror, raising your arms. And when you raise your arms, you have to raise it all the way up because what you're looking for is any retraction, any dimpling in your breast, any kind of changes. You're like, wait a minute, it's on one side and not on the other. What's going on? Right. So that's what I mean when I say do this. You could do it in the shower or you could do it afterwards when you're laying in the bed and just make sure you examine. I won't go through the whole thing of what needs to be done, but go to queenquanta.com. At the very bottom, there's a link that will take you to watching the videos of how to do these breast exam as well. So it gives you different ways and motions of how to do your breast exam. Now, for the mammogram, you have to get that done once a year. Here's one of the questions I received from you. Said, my mother had breast cancer. I'm 34. Should I get a mammogram or wait? Well, my dear, if you're on, thank you for your question. However, I cannot answer that question thoroughly unless I know the age at which your mom was diagnosed with breast cancer. So I need to know that age because the recommendation is based on the age at which your parent was diagnosed. So if your mom was diagnosed at 40, then the mammogram or evaluation will be recommended 10 years prior, which would make it 30. Now, in some cases, females may be too young to have a mammogram, but then there's always ultrasound, right? So, knowing your risk and knowing when to get a mammogram is important. If your mom was 55, then you would be still in a high risk group, but your mammogram would be at 45, which would be past the recommended age anyway, if you're doing what you're told, which is to begin your mammogram at 40. So if we look at what an average risk person is, that would be someone who has no personal history of breast cancer, no family history, no family genetics, no radiation treatment when they were younger than 30. And therefore, you would be considered at average risk and you would do your mammogram as recommended beginning at age 40. The mammogram for those who are high risk, you would need to speak with your primary care and they would give you more information. And we'll talking a little bit here about what a high risk person is or what makes someone high risk. So, again, breast cancer screening, all women should have their mammogram starting at age 40 for baseline. For some, it would be earlier, right? So, or 10 years earlier than a family diagnosis. So, what's your family history? It is so important to know your family history. Unfortunately, for the what are they called? The baby boomers. Some of the baby boomers, they do not talk about their history. And now their children or the next generation upcoming do not know if there's anyone in their family who had cancer or not. But some of these stuff you really can find out on your own. And this will make a difference for you also. You may have heard the term breast density. Let's see. If you'd had your mammogram, I won't put this out there, put you on blast. If you'd had a mammogram within the past 2 years, just give a thumbs up or say, yes, I have. Oh, if you are on Instagram, I won't be able to see your comments. But if you've had your mammogram within the past 2 years, it should be annual. Give a thumbs up. That's what we need. We need to make sure everything. If you have a family member who has not had a mammogram, you need to say, yes, I'm going to ask my family member to get their mammogram because you're over 40. There's nothing to be afraid of. Thank you. I see some confirmation there. Fantastic. So, when we're talking about breast density, you may have heard some terms thrown around and you're like, well, what does it mean if I have a dense breast? All right, we're going to look at that. Some folks, when they're younger, it's not really age related, but you can see if you look here, this is a mammogram, and you're looking at this is these are designation as to what angle is being taken. So this is a right medial lateral oblique or oblique, as they would say. I say oblique. And you can see here just how dense the breast is, right? You can see, look at how dense, you can see everything there. Whereas if you look all the way over here, you can barely see anything. This would be a fatty breast. This here is a dense breast, and this is what's in between. And that is why sometimes for folks who do have dense breast, they may recommend that, hey, you need to get an MRI because if there's something in there, they may not be able to see it. Most of us are in this region here where it's sort of in between. And what the reason why it's so important to do your annual mammogram is that if there are changes, then it would show up. You know, if you look at this mammogram, I see, and you thought you didn't know what a mammogram was or you couldn't read a mammogram. Look at that. Now you know how to read a mammogram. All right. But this is a magnified view of a mammogram of someone who just had one. You could see these little white calcification, these little things here. These would be referred to as rough, and these could be just calcification within the milk ducts. And they would mention it in your mammogram report and say, hey, you have some calcification, but they look like milk ducts because they're so large, etc. But they will keep their eye on it every year that you take it to make sure that there's no increased calcification. So this is what they're talking about when you see a mammogram and they say, oh, you have calcification there. Now, this here is showing here This is a mass closer up to the axilla. And if you could see closer, there are some really tiny calcification in the middle, but it doesn't matter because here you can see what the mass looks like. In some cases, it may be some little tiny clusters of calcification, and that's what they would target to biopsy. So now you know what the mammogram is looking for. You can't see it with your naked eyes, not all of that. You cannot see the calcification with your naked eye. So do your annual mammogram. Questions I've had is well, a lot of folks are still afraid of going to the doctors and they're saying, well, why do I need to go to the doctor? There's nothing wrong with me. Come on. Why do you put gas in your car? Why do you take your car to the shop? Right? Mhm. Don't take better care of your vehicle than you take care of yourself, right? Okay, Lord, help me, help us, help us, Lord, take care of ourselves. So the question I always get, well, what should I look for to know if I have breast cancer? Honestly, most of the time, there are no symptoms. 30, 40 years ago, before the advent of mammogram, people used to present with masses in their breasts and breast changes simply because they could not see inside. Now we have mammogram. Technology is fantastic, right? We could see inside the breast. And so with the advent of the mammogram, we're catching breast cancer earlier and earlier, which is phenomenal. I love seeing a patient and say, "Hey, you got stage 0 or stage 1." I'm like, "Yes, Lord, we caught it early." Hmm? So don't wait on symptoms because majority of the time there are no symptoms. Sometimes you may have a painless firm mass, some persistent change to the breast, some thickening, swelling, dimpling. If it's getting to that stage, it may have gone a little bit further on. Not to say that it's beyond a stage where it cannot be treated, but if you could feel something and they say it's cancer, chances are it's not a stage 0 anymore, right? Some other things you can look for if you're concerned about nipple changes, if there are any ulceration or blood coming out your nipple, that's not normal. If you're not breastfeeding and stuff's coming out your nipple, that's not normal. The thing is, though, there are females who would say things to their girlfriends before they would say it, go to the doctor. So now you know if a friend or a family come to you and say, hey, look, something coming out my nipple or my bra keep being wet right up my nipple, and they're not breastfeeding or around people who are breastfeeding or anything like that, they need to get that checked out. It could be nothing. Sometimes you just collect fluid in those milk ducts, and that could be it. But do not be the person who is, don't diagnose yourself. Let's go find out what's going on. If your car making the sound clunkety clunk, 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 you're not going to try to figure it out yourself. So same with your body. I'm sorry, y'all. I like referring to the vehicle because most people drive a car, or even if you take the bus, you understand the reference with a vehicle, right? So, any kind of changes or concern, just go ask your doctor. Looking up on the internet is not the same either. Okay. Thanks, Pam. Hi, Pam. Thanks for joining. So, the next question I received was, nope, I have no cancer in my family. I only have diabetes, and folks have heart attack or heart issues. Am I still at risk for breast cancer? Yes, ma'am. Yes, my dear sister friend, you are at risk. So, what are some of the things that put you at risk? Nobody in your family has it. So, how is it that you're at risk? And we'll talk a little bit later too about what it means to be at risk. So, you're at risk for breast cancer if your biological sex is a female gender, if you age of first childbirth. What age did you have your first child? Didn't matter. Or if you have no children, you are at risk for having increased risk for breast cancer. Estrogen exposure. The longer you're exposed to estrogen, the higher your risk for getting breast cancer. What does that mean? your age of first menstrual. So if you start your menstrual cycle at 10 and then you had menopause at, I don't know, 60, that's a lot of years in between to be exposed to estrogen, right? So that puts you at risk. So early first menstrual cycle or late menopause. And if you're postmenopausal and taking estrogen, that's going to put you at risk for cancer as well. Increase age. If you're over 50, you're at risk. Now, don't be fooled. The youngest person I've treated for breast cancer was 27 years of age. Yes, 27. And that's why I was so chagrined and upset when they were trying to make the mammogram time, the age for mammogram 50. It's like 50. Are you kidding me? That's like 25% of my patients you're missing. So I was super excited when it went at least to 40. And then I can talk the younger folks through when to get attention and when they should seek assistance as well. So, age over 50, if you've had breast biopsy or if you have a history of cancer when you were less than 30, of something else, when you're a child, you have some childhood disease and you had to have radiation, that puts you at risk also. Please go ahead and share for me. This is fantastic. I thank you all for being here. Now, now this is a very interesting question as well. So my grandmother had breast cancer. Will I have breast cancer too? And this was a question asked by a young lady who was concerned that her grandmama had breast cancer and what her risk would be and what can she do. I think she was around 14. What could she do? In what are the numbers, etc. So I thought this was it was a good question, right? So when it comes to talking about breast cancer risk for your relatives, if you have a first degree relative that had cancer, then that increase your risk. And a lot of folks, whenever I do my consultations now, because I'm doing stuff for myself on my internet, they would ask me, I've been trying to search things on the internet, and every time I come to a term, I have to look up what that term mean, and then I look up what the meaning of that term is, and you just keep spiraling down, right? And that's why we're giving this information out so we can educate you about some of these basics. So when we say a first degree relative, quite simply, your mother, sister, your daughter. So if one person, you had increased risk 2 times. If it's two persons, increase risk 5 times, right? For the grandparents, the second degree, that's your grandparents, aunts, niece, half siblings, then you are looking at a 1.5 times increased risk. And I'll talk about the definition of what it means by risk in a moment. Hang in there with me. The Ashkenazi Jewish descent, genetic wise, they are at higher risk. And then there is a familial breast cancer, which is 10% of patients. So a lot of times people are thinking, oh, I don't have to worry about breast cancer because nobody in my family has breast cancer. Well, of all those 207,000 breast cancer diagnoses in the US every year, it's only a small portion of that. Only about 10% of them actually have family members who had cancer. So majority of the folks who are diagnosed with cancer, there's no family history. So don't be fooled with that one. Do your breast self-exam and get your annual mammogram. Okay. I'm 38 and I felt a lump in my breast. Is it cancer? I don't know. And you won't know either. Over 80% of breast lumps are non-cancerous. So that is why we talk about the importance of doing regular monthly breast exam. First question, is it something that's new or is it associated with your menstrual cycle, right? Because some folks are told that they have fibrocystic or lumpy breasts as well. If you notice with your cycle, your nipples will get tender, your breasts will get tender, and sometimes you feel it to be lumpy. That tend to happen with folks who are between age 20 to 40. Any other changes associated with this? Are you having nipple discharge or you notice any skin changes? You need to let your doctor know. If you're feeling a lump, Go in, see your primary care. It doesn't take much to get a mammogram. Even if you just had a mammogram, don't let that delay you either. Still go in and talk to your primary care and say, hey, I'm having these changes and it didn't go away. It's not with my cycle. This is new. I've been diligently doing my monthly exam and this is new, right? So let's look at cancer prevention versus cancer risk reduction. And I have to apologize in advance. It seems as though this here may not go away. So when we're talking about prevention versus reduction when it comes to cancer, what do we mean by that? Cancer prevention is something that you're able to not have to deal with, period. So one of the cancers that is really big when it comes to cancer prevention is cervical cancer. Nearly all cases of cervical cancer is caused by HPV. And so that's why there were this big push to get the HPV vaccine for the younger kids. That's beyond the scope of this presentation. But the bottom line is, if you don't have HPV, then chances of you getting cervical cancer is not going to happen. As you can see, HPV is responsible for approximately 95%. And at one point, we used to have a lot of cervical cancer. But once we start doing the pap smear, I'm going to put a plug in for that as well. Make sure you're getting your pap smear. Once we start getting our pap smear and all that, the cervical cancer rate in the US has taken a dive. It's like, wow, right? So we need to get that done. And for those who do have the HPV infection is usually 16 and 18. If it persists, you can get precancerous lesion. That's where the pap smear comes in. Because if you're having your pap smear, they see something, they can just remove it and they'll do it more frequently. I think now they have it where they're doing 3 years, 5 years. They keep changing it. So don't take my recommendations on that one. Talk to your primary care, your gynecologist, and find out when you should do. But cervical cancer is a cancer that you can prevent. If HPV is the cause and you don't have HPV, you won't get it. That's prevention. Okay. Now, the other cancer would be colon cancer. This you may not be able to prevent, but you can definitely decrease the risk. Another plug, colon cancer, get your colonoscopy. I don't do with the the stool kit. I almost say poop kit, but the stool. Let me tell you the truth. You could have hemorrhoids. There may not be any bleeding. If you do the colonoscopy, it's once. And if you're good 10 years, you don't have to worry about it. Right. And the reason why I advocate for the colonoscopy, and it is still the gold standard, by the way. We'll just take whatever you'll allow us to have. If it's the stool, we'll take it. But when you get a colonoscopy, they're able to see if there's any changes in the colon. And if there's any polyps, they could just remove it right then and there. You don't have to wait. Now, if you have a polyp and it's not removed, then it can grow into becoming a cancer. This is something when you have a colonoscopy, you can do a risk reduction. May not be able to prevent it if we don't see the polyp, etc. I hope that was clear. Does that make sense to you guys? Let me know in the chat. Do you guys get that with the prevention versus risk reduction? If you have questions about that, just pop it in the chat and I'll be sure to get to that. Now, what can you do to reduce the risk of breast cancer? Again, now remember, may not be able to prevent it, but you can reduce the risk. Let's see what we got here. First thing, when we say exercise, this is not what we mean. You don't have to be a bench press person and getting bulk up. Well, I'm not quite bulk, but I'm trying to get there too. But when they say exercise, they're talking more like getting out, doing some walking, stretching, yoga, right? See, they're showing you here to do that little Tai Chi stuff. It doesn't matter your age, just get up and move. Consistency, though, is key. You can't walk a mile today and then 3 months later walk a mile and say, yes, I'm exercising. No, my dear sister friend, that's not what we're talking about. You got to be consistent. Get out, get on your bicycle, go for a ride. It's summer now. No excuse. I'm taking no excuses today. No excuses. Then, quit the smoking. There's so many carcinogens in smoke. It's bad for you. Alcohol, everything in moderation. So decrease alcohol, stop the smoking. It's just bad stuff. Now, reduce the risk of breast cancer. It's been shown that if you breastfeed for a long period, that may help to reduce the risk. How long is long? I don't know if you want to have a 4-year-old or a 7-year-old still breastfeeding. So I'm going to leave that up to you. I know you want to reduce the risk of breast cancer, but I don't know if you want to have a 5-year-old still breastfeeding. I don't know if you could use that as an excuse. I'm just saying. I'm just saying. You know, I'm thinking by the time they're 1, 2, if they're looking like this age here, I don't know. I don't know, Sister Fran. You may want to say something about that. Oh my. So just be physical, be active, look at your weight maintenance, obesity, limit alcohol and tobacco use, breastfeed may play a role, limit postmenopausal hormonal therapy. So if you're postmenopausal and they have you in estrogen, you may want to have a conversation with your primary care about how much this may increase your risk, right? And the biggest thing now is that the knife and fork is fast becoming the leading cause of death in America because there's so much associated with um, obesity, just eating a lot. We just need to come cut back. So how is breast cancer diagnosed? Trying to stay within this time frame here. So if I need a biopsy, what's next? So you may go in, you feel something, and they're saying, okay, you need to have a biopsy. And when somebody first hears that, that's causing folks to just really freak out, right? Because now you're like, oh my gosh, I got to get a breast biopsy. What do they mean by that? They cannot tell if there is something in your breast. They cannot look on a mammogram or an MRI to say if it's cancerous or not. We need tissue. And the only way to get tissue is to go and take a sample of that abnormality in your breast. So there are different ways of doing this. They can have you lay down and have the breast hanging and do a stereotactic biopsy. They can, oh, but first they'll numb the area. They'll always numb the area. There's no general anesthetics or anything like that. It's a local area. They'll numb it. They can also use an ultrasound and then take a biopsy of the area like they're showing here, and it'll be quite numb. If you're getting a biopsy and they put the needle to take the biopsy and you can feel it, you need to let them know. You have to speak up as well. Okay. So once the biopsy is taken, then it's sent to a pathologist to find out, is this cancer? Is it not cancer? And they have to look under the microscope and decide for you. Now, this is going to take some time. This is going to take some time to find out. And the apprehension is real. This can cause a lot of anxiety because now you're wondering if it's cancer, is it not cancer, what's going on? And this is where you need support and prayers and everything else while you wait. We want to make sure they're giving you the right thing. So it's going to take about a week. So be sure to ask, when am I supposed to get the results? And who do I contact if I don't hear something within a certain amount of time? All right. So let's talk about breast cancer treatment paradigm. If you have any questions, please do drop it in the comment section and let me know what questions you have. I see one asked there about age and pap smear, and I will answer that in a little bit. All right. So let's get to your cancer care team. There are a lot of people on your team, and you need to know who they are and what they do. So if you've been diagnosed with cancer or know someone going through a cancer, it's a lot of information and you have to know what questions to ask, right? And that's where you come in, being a support for the people who are going through this cancer diagnosis and treatment. So you have your primary care, who's someone you should trust when it comes to this information. The radiologists are the ones who do the mammogram, your surgeon, plastic surgeon if you're going to have reconstruction, the medical oncologist, which are the chemotherapy doc, and then the radiation oncologist, which is what I do. I'm a radiation oncologist, so I treat cancer using radiation. And there are a multitude of other services as well that are involved with your team. You have to ask your doctors questions. You have to be involved in your care. I put this up here because everyone in here have a pair of shoes. And when you went to buy your shoes, it was your decision, right? You tried it on, you see if it fits, you decide which shoe you want to buy, what looks good. I'm not saying the doctors are like shoes, but you should be able to be a part of the decision making process of your own health. Cancer, primary care, whatever it may be, you need to be able to ask the doctor your questions that you have. And a lot of you I know are saying, well, I don't know what to ask. I will give you information on that at the end. When you're going to buy a car, you look up and you ready to ask questions about your vehicle. So why is it any different when it comes to your health? You go to the doctor, and I know I've seen it, and you just sit there and clam up. Any questions? No question, right? So you have to prepare for your doctor's appointments as well. Be a part of your treatment decision. Cancer, regular health, whatever it may be, just be a part of your health. It's your body. Take charge. It's your temple. Be prayerful about the things that you do. Ask questions. And there's no such thing as a foolish or a stupid question. Let me tell you that. It's our job as physicians to make sure you understand what it is that we're recommending and why. And it's our job to break it down, just like I'm breaking it down here, to the level that you understand it. If they can't speak at the sixth grade level and they're using big words and you don't understand, you need to say, hold up a minute now. What does that word mean? Break it down for me. You're not going to be the one that's looking or feeling foolish. They will. It's their job. They're there for you. And I try to tell all my clients that, my family, my friends, like we are there for you. Okay. So, breast cancer staging, only a few more slides. And please drop your questions in there and I will get to them. If you're diagnosed with breast cancer, before they can make any recommendation, they have to stage the cancer. And that's something you have to understand what that means, right? No recommendations will be made until they know the cancer stage. And that's really go for any cancer. In breast, they're going to look at the tumor size, the number of lymph nodes. Remember, we talk about the axilla under the armpit. So they have to look there too and biopsy if needed under the armpit. And then the M is metastasized. Did it leave the breast and go anywhere else? And so the stage is T, N, and M. And then they'll also look at the tumor receptors. The tumor receptors, estrogen receptor, progesterone receptor. That's a whole nother class, but it's important to know what these mean. And we discussed about estrogen exposure earlier as far as what puts you at risk for breast cancer. Now they're looking to see if your cancer have these receptors on them. And that's where the triple negative breast cancer comes from and all of that. But here again is just a brief little introduction. You also have to understand the difference that the grade of the cancer does not equal the stage of the cancer. And it's up to them to tell you what the grade is and what the stage is, right? So you have to talk to them about stuff. And sometimes you need someone to hold your hands and really take you through all of this process because it's a lot. It's like a job. And we're going to talk about how you can be there for your family, your friend, your loved one who may be going through this process as well. All right, so there's a lot to do. Remember again, they're not going to talk about any treatment until they know the stage. Oh, it's like when you take your car to the mechanic. Thank you for that download, Holy Spirit. It's like when you take your car to the mechanic, you take it in there and you say, okay, I hear clunk, clunk, clunk. They're not going to tell you right then and there what that noise is. You have to leave it with them for a while for them to run their diagnostics and all that stuff. And then you have to wait for them to call you. Is the same thing. Well, approximately. They have to go through all of the results and all the information and see what your stage is before they can make a recommendation for treatment. And that is what drives some people bananas because they have to wait to gather all that data before they talk about what can be done. That is where prayers come in. That's where your community comes in. That's where all the support comes in to wait and see what's next. All right, everyone, I've covered quite a bit here today. I talk about the treatment decision making process, and I just really just the surface, just to give you an introduction so I can empower you to get your mammogram, to encourage folks to get their mammogram, to do your breast exam. Now, the other parts on surgery and chemo and endocrine and radiation, each one of those is a review in and of itself, info, and we will keep you in the know. Now, in the beginning, I did promise you about, well, what can you do in order to support others who are going through the cancer treatment? You don't know what questions to ask. That's where this journal come in. Myself and about four other physicians back in 2011, I can't believe it's been that long. We were each trying to do advocacy work, and you're like, well, they're always the patients that don't know this, they need to ask these questions. This is on Amazon, so you'll be able to find it there. But in this journal, it's a very simple journal, but it has the questions to ask your doctors and areas to just write things down. You know, people try to do things on their phone and iPad, and then you go back looking for things you can't find it. Pen and paper still works. So, what this breast cancer journal does is that you're able to put in the doctor's name, what hospital, what's their contact information, and some specific questions to ask. Because a lot of time you go and then you go back and your family's asking you all these questions, and you're like, I don't remember or I don't know. So you can write it down. These are questions you can ask directly to the doctor and they will tell you. And when you ask the question, it will make sense when they answer it for you. So simple, what type of cancer do I have? Can you write it down for me? They will do that. So there's a general portion of the cancer journal just for any cancer, right? Has it spread anywhere else from where it started? If yes, where? Did it spread to the brain? Did it spread to the liver? Write it down. Can you explain to me the stage of the cancer? This is an example taken from the book of just general questions that you can ask, right? Then, specifically in the cancer section, you'll have let's see here. You'll have questions that you can ask specifically for each specialty. So if it's a breast surgeon, you could write the breast surgeon's name down, the hospital, the clinic, their phone number, is their email, what's their nurse's name. A lot of times you can't get through to us doctors, but guess what? The nurses, the nurses are the nurses are gatekeepers. So if you get to talk to the nurse, they can definitely help you with getting some information or making sure you get back in to get to the doctor. But you want to write down your breast cancer, the clinical stage, what it is before surgery, the breast or both. I have treated folks who present with bilateral breast cancer in both breasts at the same time. You want to know what they saw after the surgery. You need to ask them, what's your stage, the size, the lymph node involved? What type of surgery am I going to have? What do they recommend? What do they not recommend? All of that you can find in this book as well. So if you're interested in getting that, that's what Q4CD have asked me to do. It's in the chat, so you'll be able to see that as well. If you're able to go to the q4cd.com, the website, Queen Quanta, or either of them, you'll see a link for this book. There's also a link there for prostate cancer. So if you have a loved one who's going through prostate cancer, it's there too. But one of the things that I've gotten a lot of great feedback about this book is that in the back, it has a follow-up plan. So there's a 1-month follow-up, there's a 3-month follow-up, who you saw. You can document what kind of side effects you're having. If you know someone diagnosed with breast cancer, this would be a good gift as well. So Thank you for your support and being here. I will take questions. Everything I've mentioned will be located on my website, which is queenquanta.com. I will entertain your questions now. Please do post them. You are welcome, Brenda. Thank you. I'm glad that was helpful for you. It was very brief, just and skimming the top, really just to empower you and give you some basic information. There, there was a question asked about pap smear and age. Typically, there's not a set age per se. However, the best way to find out, I always give my disclaimer, is that you need to talk to your primary care about what you should do. 80, unlikely. However, if you're experiencing any sort of issues, if you are having any bleeding, now, if you are 65 and over and you are noticing you're having any sort of bleeding, then that's not normal. You're postmenopausal. So go in and see your doctor. You have to go in and get things checked out. All right. So at 75, 80, typically pap smears are not something that's recommended or that you have to do. But ask your primary care. That's a good question right there. That's a good question. Do I need to get pap smears still? Right? And they'll tell you no, because I don't know your entire history, so I can't make that an absolute, right? So thank you, Candace. Thank you, Shannon. Glad you're able to join. Thank you, Angelica. Thank you so much. Thank you, Edna. You are welcome. Thank you so much. Appreciate the kind words. Any questions in general, just about your health that you haven't been able to ask or feel uncomfortable discussing with your doctor? Oh, I almost forgot. I've started a new podcast on intimacy after. So, intimacy after cancer, intimacy after weight gain, weight loss, intimacy after the loss of a loved one. Again, if you go to Queen Quanta, you'll find that there as well. And you can visit the site, all the books and the podcast and everything is on there. Ah, what's this? Oh, well, thank you so much for that question, Jay. Breast cancer in men, most definitely. So, when it comes to breast cancer in men, they make up about 1% of all the total diagnosed breast cancer. And for men, it's usually easier to find, but they usually present at a later stage for the simple fact that they're in denial most time and saying, oh, well, what's that little thing? It's not a problem, until it becomes larger before they actually go in. So men do have breast tissue as well. And so men are at risk. If you or a loved one notice something on the chest of a male and you may think, oh, maybe it's an ingrown hair and it doesn't go away, you really need to have that checked out. Unfortunately, for men, when they have breast cancer, is usually more aggressive or more advanced. So we want to make sure that we go out and check these changes. And so if something is there, don't play around. Go to your doctor and say, hey, I know it's only 1% of men that have breast cancer, but I'm concerned. What is this? And what they'll do is they'll take a biopsy, they'll take it out. And I have treated, I would say, of all the folks I've treated over the years, about 5% or so were males. And I think mostly I have a higher percentage of male because I was in the military, right? And we know over 80% of the military in the army were men. And so we would get a lot of male breast cancer. So, yes, males do have breast cancer. Do you think there will be a cure to breast cancer in our lifetime? I surely hope so, Pam, but I don't know. There's so many research going on in that area, but I don't know where they are in the research because by the time it gets to me, it's where they're doing human trials, let's say. But they are working hard at it. I've heard the myth that, oh, there is a cure and they're sitting down on it and don't want to share it. I don't think that's true. I hope that's not true. I don't think that's true. Why would we sit on it? Because the person who find the cure, it may be someone in their family that has it, right? So not at all, not at all. But we're working towards it. We're definitely working towards it, Pam. And I know a lot of organization, a lot of larger hospitals, they're doing research. So I'm hoping that they will find the cure for that. Here we go. Another question. Have a blessed night. Thank you, Angie. Have a blessed evening. Another question here. So we hope they will find it in our lifetime, or at least get close to it. Because I'm going for 120. I'm gonna be like Moses. I'll be like, okay, God, I'm done. I'm gonna lay down now, right? I got lots to do. So the other question is, would you say it's more prevalent in men with more fatty chest, or should muscular men be concerned too? All men have that fatty tissue. So whether you're muscular or it's fatty, you still need to examine the area. And if you feel something abnormal, get it checked out. It's not more prevalent in one or the other. I've never seen any study regarding that to say if someone is more muscular, they're at lower risk. Because remember, with cancer, it's all about the cells. Everything is at the cellular level. And what was done in the past to put you at risk, be it smoking or you're drinking, or so it's totally not applicable to your body habitus. So it doesn't matter if you're fat or lean or muscular or in between. If you're at risk, you are at risk. Anything abnormal, if your car go clunky, 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 you take it to the garage and have a mechanic check it out. If your body has something that's not looking good or feeling good, take it to the mechanic who's the doctor. Don't be your own doctor. Take it to the mechanic, take it to your doctor, and have them tell you what's going on. Okay? Hope that answered your question, Jay. Thank you so much for being such an active participant. I love it. I love it. I love it. Any other questions? I hope to do this once per month on different topics. And one of the big requests was for prostate cancer, but I don't know. With guys, it's so difficult. But I think if the females know about prostate cancer, then they would be able to urge their male counterparts to get checked out. So if you're interested, check out my website, leave me a voice message. I'll send you a survey to see what you want the next topic to be on. And I'll talk about that, whatever topic you want it to be health wise. Now, I do deal with cancer mostly, but at the base of everything we do as physician is health, right? So I'm trying to do intermittent fasting stuff, staying in shape. I'm doing all the stuff, staving off diabetes. I can have guests on as well. So if you have a topic of interest you'd like to know about, just let me know on my website, which is queenquanta.com. And pick up those books. Get those books out for me. I would love it if you do, because it would support the nonprofit that will keep me coming on. All right. Well, that's it, folks. Thank you, ladies and gentlemen, for spending this afternoon with me. This has been a pleasure. You are most welcome, Cora. And thank you so much, Connie. And maybe we could all hang out once a month and get better, get healthier together. We got one life. That's two. One. We got one life, one body. Let's together work together to be as healthy as we can. Until next time, thanks everyone. This has been phenomenal. Thank you all for being here.